Hello everyone, greetings for the day. I am Sanya, your host from All About Skin Wellbeing. I am sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. Fungal infections or mycosis are diseases caused by fungus or yeast or mold. Mild fungal skin infections can look like a rash and can be itchy and annoying. Antifungal medicines can treat fungal infections. Antifungal medicines can kill a fungus, or they may stop it from multiplying or growing. There are several classes of antifungal medications and different types of medicines. So let's connect today with our skin expert, Dr. Shreyaswini Pujary, live from Bandra East, Mumbai, to enlighten us on the topic of antifungal. Dr. Shreyaswini Pujary is a dermatologist with 8 years of experience in clinical and cosmetic dermatology. She has completed post-graduations and 4 years of residency training in dermatology and venereology, which includes 2 years in JSS University College, Mysore, and 2 years in KJ Somaiya College, Mumbai. She is NB board certified for the practice of dermatology in India, that is National Board of Examinations, New Delhi. Dr. Shreyaswini has a rich experience in cosmetic dermatology also. She keeps herself updated in all fields of dermatology by attending national and international conferences and CME programs. Dr. Shreyaswini is a life member of IADVL, that is Indian Association of Dermatologists, Venereologists and Leprologists, and IMA Juhu, Mumbai. Dr. Shreyaswini, first of all, a humble welcome on our live.
Thank you so much for a very good introduction.
As we're going to discuss about the anti-fungal infections, and rains have hit India, and in this season, most of the people complained about the fungal infections. The itchiness, the redness caused due to the antifungal or the climate conditions. Doctor, when we are first, talking about the fungal infections, what are basically fungal infections? How can we define fungal infection?
So basically, fungal infection is caused by fungi. So what are exactly these fungi? They are yeasts or molds or a combination of both. And they normally produce very tiny spores. And these spores can exist in the soil or it can become airborne. And they spread from person to person.
Okay, so there are chances that the fungal infection can be spread from one person to another.
Yes, definitely yes. If you share your clothing, so that's how.
Okay, and sometimes we see some people itching or scratching their hands.
That further increases the spread of fungal infection.
Right. So we should, stay away from people because, as the doctor said, fungal infections can be spread. And today we are going to discuss about the fungal infections. As doctor said, it is caused by the fungi. And today we are here. Our expert, Dr. Shreyaswini Pujary from Mumbai, and she will be enlightening us with this topic soon. And as I already told you that taking good care of skin is important for all of us, and also fungal infection can cause your skin look itchy, bad, and this fungal infection can be itchy, rash, like structure, and can be annoying too. And so soon, Dr. Shreyaswini will join us and enlighten us on the topic of antifungal. And as antifungal, I told you, because as we were discussing the doctor, that it can spread from one person to another, and as rain have already hit India, I prefer that you should take care good of yourself and consult to a dermatologist if you are facing such kind of rashes or itchiness, because it is important to take good care of your health. And we will be discussing today about the antifungal diseases, how it can be treated, what are the causes of antifungal, and what are the examples of the antifungal medications, how would the antifungal medications work, and are there any potential side effects? So all this we are going to discuss in this today's live. Hello, doctor.
Yeah, I'm so sorry.
It's okay.
Yeah,
No problem, no problem. So I was telling all the viewers that today we are going to discuss about the antifungal treatment, the causes, the risk factor, and everything. So, doctor, when we are talking about fungal infection, and as you already told that it can be spread from one person to another. So, what is the risk factor of fungal infection if we talk about the risk factor of all the fungal infections?
Okay, so basically anyone can get a fungal infection, even people who are healthy, but most often we see fungal infection in people with weakened immune system. Okay, so we call it a suppressed immune system, like immunodeficiency diseases and diabetes, and when they are on certain medications like steroids and chemotherapy for cancer. So these people are more susceptible for fungal infection. And people commonly at risk are people who sweat heavily and they are working in hot and warm, humid environment, walking barefoot in damp places. These are all the risk factors for increased fungal infection.
Okay, so ma'am, as you said, that these are the anybody can have fungal infection
Yeah, even healthy people.
and at any point of time,
Yes.
So, are there any, what we can say, any triggers of or anything, which causes the fungal infection? That if somebody have eaten something or somebody went out somewhere and उसके बाद उन्हें ऐसा लगा कि itchiness or something. Usually, people must have come to कि garden में they were gardening and when they came back, so itchiness and it is there. So कई बार I think आपके पास patient must have come, that ऐसा हो गया डॉक्टर now what to do ये spread भी हो रहा है sometimes.
Exactly. So basically, when people are working in hot and humid climates, they are more prone to get fungal infection. And secondly, if you're walking barefoot in wet areas, so as I told you already, that fungal infection is caused by the spores. So the spores are present in the soil. So when you walk barefoot in areas, wet areas, you tend to acquire these spores, and these can be also the reason for acquiring fungal infection.
Okay. And then when we talk about the fungal infection, and there must be some antifungal treatments which are available. So what do like antifungals treat? How they basically treat the fungal?
So basically, what antifungals, how do they work? They can definitely stop the progression of your fungi. They can basically stop the growth of the fungus, or they can also kill the organisms which are propagating. So antifungals basically work for fungal infection, fungal skin infection, or the one which is systemic infection. So when we talk about skin infection, it can work on, we call it athlete's foot or jock itch or ringworm. These are the common terms used, and they work on dandruff, finger and toenail infection. And we call oral thrush. Oral thrush is basically infection of the oral cavity, and vaginal fungal infections. So this is how the antifungals work. And
Okay.
there are various classes of antifungals. We can discuss this further as well.
Yes, and as you said, that it can be dandruff. Like the causes can be anything, and it
Yes.
can be like due to the dandruff, or as you say, the vaginal treatment. Doctor, how somebody should identify that this is the fungal infection, and they have to go to see a doctor. What are the symptoms I can say of the fungal infection?
Fungal infection. See, normally fungal infection presents as a itchy eruption on the skin. It can appear round or it can appear whitish in color, and it continuously spreads. And the common areas are mainly the skin folds, like your underarms, your inner thigh area. These are the common areas where you see fungal infection, mainly because of the wetness.
Okay. So, are there any precautions, somebody should take rather than, like going out, any, anything, any cream or something which somebody should apply, for like saving
Prevent.
themselves from getting fungal infection?
See, as I already told you, anybody is prone for fungal infection. So, as such, hygiene is a main important thing I always tell most of my patients. Hygiene should be maintained. Keep your skin folds, especially the skin folds, clean and dry. So this can prevent you from getting infection. And always wear footwear in, like, damp areas. Just don't walk barefoot in damp and water places.
Okay, and as rainy season have it India, people will go, barefoot, that enjoying the rainy
Enjoying
season.
the season, yeah.
And but as doctor said that don't go out barefoot, take proper measures because it can cause you fungal infections. Doctor, we are discussing about the fungal infection. Are there any, types of fungal infections?
Yeah, there are multiple types of fungal infections. So we see mostly skin related infections, and fungus also can affect your hair, it can affect your scalp, it can also affect your oral cavity, it can also affect your nails. Also, it can affect your private parts and also can give you vaginal fungal infections. So there are multiple fungal infections. And lastly, there are systemic fungal infections, and they are like a total different discussions altogether. You can get lung infections, you can get food pipe infection with fungus.
Okay, so is it not like that, that they are only visible to your skin? They can harm your inner body as well.
Exactly.
Okay, so if not treated rightly and if you do not go to a dermatologist as quick as you identify your fungal infection, it can affect your body as well. Sometimes, doctor, patients, they don't go to a dermatologist, they just go to a medical store, ask for a medicine, that ये मुझे red हो रहा है, कल से हो रहा है, तो मैं क्या दवाई खाऊं? And they give medicine, and then they go to a dermatologist after realizing that this is a very big issue and this needs some attention. So are they, people coming to you like that, that hum gaye the, and now it has become a chronic disease?
Yes, so basically earlier, like, during the times when we were studying, fungal infection was like really easy to treat. So these days it has become quite difficult to treat because there are a lot of fixed drug combinations, like there are antifungal, antibacterial, steroids put in a same tube, and patients are using it since many months and years, and they basically give rise to resistance of fungal infection. So the fungal infection, which used to respond within a week of antifungal therapy, is taking longer duration of time. So I can say more than, like, 6 weeks we have to treat this fungal infection, because these days fungus tends to not respond to the regular standard treatment protocols. So in India, the pharmacy has the liberty to, like, sell all kind of medicines. Like if you go to the pharmacy, tell we have itching, they'll give you a steroid cream. But in the process, you're damaging your skin.
Yes. So it's better that you don't damage your skin. Go and refer to a dermatologist, right, doctor?
Exactly. Yes, definitely yes.
Yes, it's important. Doctor, when we were talking about the medication, so how do somebody take the antifungal medications?
So antifungal medications, they are available in oral forms, in tablets and capsules.
Okay,
They're
and
also, yeah, they're
yes,
also
please.
available in topical formulations like creams, lotions, and sprays, and leave-on applications that way. So this is how antifungal medications are prescribed.
Okay, as according to the patient, they are prescribed,
Yeah, exactly.
like the cream or sprays, and as you said, there are medicines also available.
Yes.
Doctor, when we are talking about medication, so how long it take, to treat a fungal infection, or how long do you need to take the antifungal drugs?
So basically, as I already told you, right? So these days we have to give medications for a prolonged period of time, because already they have got exposed to, I would say, wrong treatment or self-medication. So we have to treat fungal infection for at least 6 weeks and then call them for a follow-up and check whether they need further medications that way. So a minimum number of days of treatment is basically 6 weeks. Beyond that, we check them and then decide whether they need further weeks of treatment or no.
Okay, so 6 week is the necessary course.
Yes, minimum requirement.
Okay, so as you said, 6 week is the minimum required course, but sometimes when people see that the itchiness is gone, the redness is gone, they stop taking the medicines. So what are the chances of the reoccurrence of the fungal infection if the medicines are not taken properly and the dose is not completed?
Yeah, so this is what I told you about the resistance. So resistance is like, basically the fungus is not responding to treatment. This is what happens when they come as a relapse, like within the next 6 to 8 weeks, they come back to us saying the fungus has reoccurred. And when we talk to the patients, we get to know that they have either stopped the treatment in between or they have just taken few days of medications and they found that it is effective and stopped the medications that way. So this is how fungus develops resistance, and then we have to continue medicines for months together to give them relief.
Right. So if please everyone, if you are having fungal infection, please treat it properly, take full dose.
Yes.
Because as doctor said that if you not eat the medicine, not treat it well, you have to take medicines for months and then it will be a long procedure, right, doctor?
Yeah, and also a financial burden because these antifungal medicines are expensive.
Yes, definitely. Doctor, as you said, that properly treating it is important. When we have seen that some people eat something and, they get some kind of fungal infection. So is it like that, the do's and don'ts of any dietary eating, or you suggest something that, you should not eat this thing, it can cause you fungal infection. Is it like that?
No, there is no any dietary restrictions in treating fungal infection. People can go ahead and eat. But if they notice that certain kind of food is giving them more of itching, the symptoms increases, they can definitely cut down on that particular food. But as such, scientifically speaking, I have not come across any particular food items to be avoided. But there are some cases where they notice that, this kind of food gives me more itching. And as I already told you, the more you itch, the more the fungus spreads. So that way, you can
Okay.
eat that food.
So, ma'am, as you said, the more you itch, but sometimes it is very irritating. People keep scratching it, and when the other person see it, they feel that something is wrong, and something they suggest their people, to go to see a doctor because it is very tiring. Even I have last year, I have some kind of fungal infection. My hand was totally red, and I don't know what is the cause. And then I went to the dermatologist, and then they referred me proper treatment. So I think that is important to refer to a dermatologist rather than self-treating it.
Definitely, yes.
So, doctor, we also have our live viewers watching this video, and we have some questions from them. So, the first question is from Suhana Thakur, and she's asking, is it necessary to follow up after completing the course antifungal medication?
Yes, definitely, yes. After you finish the course of medications, so normally this is what we all follow these days. We continue the medications at least 2 weeks after you finish the course of antifungal medications. This is done under supervision of a dermatologist. So it's always better you finish your course, go see your treating dermatologist and see whether you actually need additional doses of antifungal medications.
Yes, so as the doctor said, Suhana, you have to go to a doctor for the follow-up. Don't leave, like everything is fine, so theek hai, so let's not go to a doctor. As the doctor said, that you have to go and take a follow-up from your doctor. Doctor, when we were talking about the treating the fungal infection, what are the potential side effects we can say of antifungals? Are there any potential side effects of taking antifungals?
Yes, definitely. Yes. See, any medicines are known to give you side effects. So, as simple as it can give you skin rash, like a itchy skin or a burning sensation on the skin, or it can give you symptoms like pain in the abdomen, stomach upset, or diarrhea. And rarely fungal infections, when treated with medicines for prolonged period of time, can give you liver damage, can give you jaundice, or severe allergic reactions like anaphylaxis is seen. Though they are rare, but yes, they are known to give you skin rashes.
Okay, so the potential side effects are skin rashes, or you can, occur from jaundice or stomach infections
Yes,
like this.
yes, 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 definitely.
Okay. Okay, so that means you have to treat the fungal infection. That is all what is this sum up of discussing and conversing. That you have to consult your dermatologist, take medication because it is important. Doctor, when we are talking about the antifungal medicines, so who should not take antifungal medications?
Okay, so when we are talking about antifungal medications, so we don't, or we can prescribe pregnant women, but definitely under the supervision of a dermatologist. Neonates are generally, we avoid giving medicines to infants and neonates with fungal infection. Also, on patients who are taking multiple other medicines, like they are taking medicines for cardiac issues, so we have to always check the cross reaction with the medicines before prescribing them.
Okay, so if any medical history is there,
Yeah. Medical history, drug history is very important before prescribing antifungal medicines.
okay, so as doctor said that before prescribing, your medical history is being checked,
Very important, yes.
is very important, and it's being checked that any kind of medicines is not you are taking, and then the antifungal medications are given to you. Doctor, what is basically, when we are talking about antifungal medications, what is antifungal resistance?
So basically, the fungus which used to respond to the standard course of medicine stop responding to the medications. So it continues to grow in spite of taking antifungal medication. So this is basically resistance. So normally some fungi are naturally resistant to certain antifungal medicines, and they can also develop resistance when you use antifungal medicines for a prolonged period of time without any supervision, and if you skip your doses, stop treatment too soon, or receive a very low dose of treatment, the fungus develops resistance.
Okay, and then we have to treat it again, like.
Yes, with the stronger dose of medicine.
Okay. So if not treated well, or if you not go to a dermatologist, then the resistance it occur if you not take your medicines, not your dose well, right, doctor?
Right, right, right.
Okay. And doctor, we have seen, that some people who have fungal infection, they are very particular, about their clothes, about their towels, that, somebody should not use it. And also, I really want to ask that, is fungal infection genetic? If somebody in their family have fungal infection, so can somebody else can get, or is it not genetic?
So it's basically not a genetic infection, it's an acquired infection. So if you use a person's towel and the person is already affected with fungal infection, as I told you, spores are not really visible to your eyes. So it is there in their towel. So you end up getting the infection. It's called, like, a cross infection. You use their products and you end up getting the infection.
Okay, so it is advisable that one should not use somebody's products?
Exactly. So you should not share your clothing, or you should not share your intimate wears or your clothes. So it is better you don't share anything with anybody for that matter.
Yes, and it is important to be hygienic and
Yeah.
not
Hygiene is
using. Yes. And doctor, we were talking about the rain, the rainy season in India. Is it like that the fungal infection, occurs more in the rainy season because some people, complain that, because of rain or the wetness, I am having itching and like that.
exactly. So as I already told you, so fungal infection is basically more commonly seen in summer season and rainy season because of the wetness and the humidity what we see. But nowadays we see it perennial throughout the year. You see fungal infection. But yes, definitely these are the two factors which can give you the wetness, and the humidity can give you fungal infection.
Okay, so because of wetness and the humidity, they allow the fungus to grow. You are like allowing them to grow in your body. That's why the summer and rainy seasons are the most prone fungal infections.
Fung-
Uh, Doctor, there any precaution measure somebody should take uh, to resist the fungal infection? Are there any precaution measures?
like basically when you come home from outside and you've got wet in the rain, make sure you take a nice shower, clean yourself really well, especially the folds, like your skin folds, your space between your digits, your fingers and toes, everything has to be cleaned really well, because these are the areas where you see uh, like commonly we see fungal infection, because you get affected by the spores and they tend to uh, stick onto your folds and give you fungal infection.
Okay, so you have to clean yourself. You have to maintain a hygiene. That
Hy-
is most important, right,
the-
doctor?
yes, hygiene is very important with fungal infection, especially in a place where humidity is on the higher side. You should always be careful.
Right. So next time, whenever you are out in rain or you are enjoying the rain, make sure that you come back to cover, and then you can enjoy rain, taking the proper measures of fungal infection. Right, doctor. Doctor, sometimes it has also seen that, people complained about that, the fungal infection is, spreading in their body. And they if somebody suggests that you can take home remedies, or you can apply neem, because neem is a common home remedy, and it is sometimes effective also. So, what is your take on taking home remedies as a treatment of fungal infection?
So, as such, home remedies can help you to a certain extent, but definitely antifungal therapy is the need. With the antifungal therapy, you can consider doing home remedies.
Okay,
But
so
home remedies alone won't help you from the spread.
okay, so both can if you want to take the home remedies, you can take, but you should also take the antifungal medications, right, doctor?
Yes, definitely.
Yes, because it is very important to take the antifungal medications and prescribed by the dermatologist. That is most important, that you should consult a dermatologist. Right, doctor?
Yes, definitely, yes.
Yes. So, doctor, sometimes people apply some kind of products, or I must say, the powder, when
Hmm.
they have fungal infection on their legs or hands or underarm, they usually apply some kind of powder, suggested by some friend or a relative, that powder is a very effective remedy for your fungal infection. It will go away, or, the cool powders, which make you feel cool. What is your take on that? People applying such creams or powder as suggested by someone else.
So basically, powders, they have a very low level of drug concentration. So when you have a full blown fungal infection, they are not really going to help you. But as a prevention, you can use powders because they keep the area clean and dry. But as a treatment aspect, I would say avoid using powders because they have a very low drug concentration. So it is basically avoidable. But as prevention, definitely yes.
So as prevention, you can
Yeah.
definitely apply powder. But once you have fungal infection, try avoiding that,
Avoid
right, doctor?
using powder. Yes.
Okay. So don't, experiment your skin at home and, asking somebody, because sometimes it's like that, the one person is treated with a particular medicine that cannot suit another person, right, doctor?
Yes, definitely. Yes. So this is the norm. Like, if one person in the family has fungal infection and he has taken a particular treatment, he tends to forward it to all his relatives. So he gives them the medicines and they are,
Mhm.
but then not all the medicines will suit everybody. So it is always under like, a proper supervision you have to take antifungal medications.
So don't take medicine as advised by someone else. And doctor, we have a live viewer question. Tina Bhargav asking, are there any long-term effect or complications associated with the fungal infection?
As such, there is no long term effect if you get it treated properly. So, but never take medicines for a prolonged period of time or self medicate because definitely it has potential side effects. As I already told you, there are potential side effects like jaundice. So, you have to be careful with the medicine intake. But as such, there is no long term side.
Okay, so there are no long-term side effects, but you have to treat your fungal infection very nicely and properly.
Definitely.
Otherwise, as doctor has already discussed, that you can get jaundice, lung infection, because people usually see fungal infection as an upper skin infection, which will get they get rid soon. But as doctor said, that if not treated properly, you can get lung infection and.
Okay. So there is a confusion. So let me tell you. So as such, you don't get lung infection from the skin infection. So lung infection is a separate entity altogether. So you don't like the infection doesn't spread from the skin, but you can also get it as a separate infection altogether.
Fungal infection can be inside your body as well. That's what
Yes.
it.
Yeah. That's what I want to tell you.
And then, as you said, it can be inside the body. How can somebody, on the skin, people can see it, right? That fungal
Yes.
infection. But if
Yes.
someone is developing a fungal infection inside the body, how can somebody, guess that this
So
is
you
happening?
Yeah, so you will develop systemic symptoms like you might be having a long term cough or you might develop fever. So that is when you know that something is wrong and you get your blood test done. And then we try to understand what is this particular infection.
Okay, this is, I think, more, what can I say, scary, that if you are getting this, if your body is not reacting well, you should go to a doctor, because
Yes,
because
definitely.
fungal infection can be, on upper part of your body and then inner part, inner
Also,
body as
systems. So basically, systemic fungal infection, like the lung infection, what I told you, it is not really seen in healthy individuals. We normally see it in immunocompromised, whose immunity is not very well strong. So we see systemic infections in them.
Okay, so you have to build a good immunity if you want that, your fungal infections should not occur. Doctor, are there any, changes in the treatment of somebody having fungal infection on the skin or, the inner body, as we discussed about the
Definitely.
systematic?
Systematic fungal infection. So we have antibiotics which go through your intravenous way. So we have stronger antifungal agents like amphotericin B. So these are the agents which we give for systemic fungal infection.
Okay, and they can be treated as well. Like there is
Yes,
no.
yes, nothing to worry.
Nothing to worry. They can be treated as well. So, doctor, we have live viewer Akansha Puri, and she's asking: are there any specific hygiene practices or lifestyle changes I should adopt to reduce the risk of future fungal infection?
Okay, as such, What we recommend is, if you're living in a humid climate, then make sure you take shower twice a day, and avoid using medicated soaps, and keep your skin folds clean and dry, and always make sure you wear loose cotton clothing and avoid tight fitting clothes, and wash your clothes regularly. And if you know anybody at home has infection, never share your clothes. So these are the main things which you should follow.
Okay, so wearing loose clothes and not sharing your clothes with somebody who is already having fungal infection. I think that is the specific hygiene one should definitely take care of. And
Yes,
as we were talking about, the lifestyle and hygiene, specific hygiene. Sometimes we have seen, we share our clothes. That this is something that I should also share. And I think clothes are the major, like, what can I say, source of fungal infection. Is it right? Sometimes is it like
definitely.
that?
Yeah, definitely, yes. So slowly, fungal infection is becoming a uh, endemic infection. Like, a lot of people are getting fungal infection in a closed community. So that is the main reason you should avoid sharing clothes. Also, when you buy clothes from outside, make sure you rinse it before using.
Right. And sometimes we shop the clothes and wear it directly. We do not
Exactly.
wash
Yeah,
it.
yeah. You should always rinse your clothes before wearing them.
Okay, so you have to wash your clothes, even it's new, because sometimes people feel, is it new? Why we should wash it?
Yeah, that's the thing what I told you. So if somebody has tried the same clothes and they already are infected, you will end up getting the same infection.
Yes, so never try that at home,
Yes,
buying something and, directly wearing. As doctor said, you should clean it, you should wash it, and then you should wear
use
it
it.
because of the hygiene purpose and because of the precautionary measures to take care of the fungal infections. Yes. So, Doctor, we have another question from our viewer asking that how long do I need to take the antifungal drugs?
Okay, so normally, as I already discussed with you, so we give medications up to 6 weeks, and call the patient for a follow up, check whether they still have active infection. And based on that, we continue the medications. And if they don't have, then we give them topical antifungal agents.
Okay, so these are like the antifungal medications which you should definitely take. And doctor, as you know, we have discussed that it is red, it is itchiness, it is, as you already told, sometimes it is ringworm. So are there any specific, like the patterns of fungal infection, or is it always like the red or, small pores kind of fungal infection, or it can be big pores as well sometimes?
Yeah, so we normally see like a ring like skin rash, and sometimes there can be pus filled lesions as well. So it depends from fungal infections. Like, different kind of fungal infections can present differently. Sometimes it can just present as white, scaly white patches. It look like, uh, dandruff like appearance it will have. And that way, so fungal infection can present differently. It can be a wet infection, looks like skin peeling and little bit of redness. So it varies from person to person, and how their immune system is, the presentation varies.
Okay, so presentation varies from person to person. How properly you are maintaining your hygiene, which is important. And as a doctor said, if you are sharing some clothes with somebody or from your close knit people, try, to wash it. And if you are buying it also, try to wash it and keep proper hygiene because it is important. So, doctor, before we end this live session, any takeaway message for all our viewers who are watching this live session?
So, as we all know, fungal infection is one of the most common skin infection we see in day-to-day clinical practice. So, the moment you see a fungal infection, make sure you don't delay it and go and meet your dermatologist and get it treated. But never do any self-medication, and never go to a medical store and ask them for treatment. So, you will end up using the wrong kind of creams and suffer for a longer duration of time.
Right. So if you don't want to suffer for a longer duration, you should go to a dermatologist, see your dermatologist, as Dr. Shreyaswini Pujary just told you that self-medication can definitely worsen your fungal infection. So try not to treat it at home. And we have discussed about the symptoms, how it look like. And as doctor already told, that rainy season is here. So try to more, take care of yourself rather than treating it by your own. So thank you so much, Dr. Shreyaswini Pujaria, for your valuable time.
Most welcome.
Thank you so much, Doctor.
It was a wonderful discussion. Thank you so much.
Right. Thank you so much, Dr. Shreyaswini Pujaria, for your valuable time. It has been quite an informative session for our viewers, and we really look forward for such more sessions in the coming times. And thank you so much, viewers, for an excellent participation. And for more information and updates on skin health and care, stay connected on our Facebook page, that is all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you so much, everyone. Good day to all.
Thank you.